Hi, and welcome to Humanity RX, where we are sharing stories that highlight the human side of healthcare and bringing you life lessons from the bedside. We are your hosts, Jenny,
Tovah,
and Jonathan.
And we're glad you're here. We are very excited to welcome Dr. John Parente here today. Dr. Parente, you have an amazing list of accomplishments, so I'm going to ask you to please kindly introduce yourself to our audience and tell us a little bit about your relationship to healthcare.
Thanks for having me. It's an honor and honestly a privilege to be on the show. My name is John Parente. I am an ER physician and I work in a community hospital treating, thousands of patients every year. And I'm in my 20th year of practice. Hard to believe. 3 years of residency and then 17 years outside of residency. And it's cliche, but it's true. I, went into healthcare because I wanted to help people, specifically those people that maybe can't help themselves, which is, the ER has plenty of patients that fit that bill. So that's really how I got into healthcare.
Yeah, I think a lot of people don't see how much actually goes into becoming a healthcare professional, like how much of our heart goes into this field. We really care about our patients and the people that we're working with. And so we definitely appreciate that perspective. Do you have a specific story or something that you have experienced in your time in healthcare that has really impacted you profoundly or changed the way that you approach things?
I could probably talk for 24 hours straight and just tell stories from the ER that offer me tremendous perspective. And I think that's, what life is all about is that perspective. I'll tell you a story of a really bad day that I had as a physician. I was in my senior year of residency at Akron City Hospital here in Akron, Ohio. I was, on top of the world. I'm a senior resident. I was very skilled for being a resident at a very good program. And I felt like nothing could stop me. I was treating patients. I was one of the best residents in that hospital, or at least in my humble opinion, I thought I was. And I had to cover the ICU team so that they could go have lunch. And so all I had to do was cover the ICU for an hour. That's all I had to do. I just had to make sure no one died and, take care of critically ill patients and just sort of be available. So that's not that hard, right? Like I can do that. And I've done ICU rotations forever. And I'll never forget, I had this patient that was sort of crashing and they needed access, venous access. So I had to do a central line, which I had done, a million times over, and just somehow was fortunate enough never really to have a serious complication. And if you talk to anyone who does procedures, does central lines, does any type of surgical procedure, if you haven't had a major complication, then it just means you haven't done enough of them because they're going to happen. But it never happened to me because I wasn't that guy, right? I was better than that. And, so I unfortunately had a very complicated pathway and course. And it was someone that had a lot of challenges. They were, a little bit obese and had kind of a short neck. And long story short, I ended up trying to do the central line. And by the time the ICU team had returned, this patient had, unfortunately, a hemothorax, which means there was some blood in their lungs, which means that when I was doing the central line, there was like a puncture of the vein down into the lungs and there was blood into the lungs. And they did have a complication. They ended up doing just fine. But I personally had never had that type of failure where I caused harm. In my career, there's very few times that I've actually caused harm. And I remember that it took me from on top of the world to feeling so humbled and so saddened by what I had done and how I was trying to treat this patient and help this patient. I actually made things worse. And the crazy part is, I was driving home that night, really depressed about the day that I had just had, a long day in the ICU, when I saw a homeless guy crossing the street in downtown Akron who got hit by a car. And I watched this happen and then got flown up into the air. And then the car hit him from the other direction. So he actually got hit by two different cars. And, I jumped out of my car and I happened to have a whole gear of stuff in my trunk. And I don't even know why. And so I was literally the first one on scene. And I cut his shirt off. I, put a seat collar on him. I happen to have one in my trunk. I have no idea why at that moment. And EMS arrived and he was in rough shape. But I was talking to him and I was with him there, and I intubated him on the streets of Akron. We put him into the back of this ambulance. We ended up doing a needle decompression because he had a pneumothorax, his lung collapsed. And the police looked at me and they're like, and I'm covered in this homeless guy's blood at this point, and they're like, what do you want me to do with your car? And I'm like, I don't know. Let's just drive it to Akron City Hospital. It's like 7 miles away. So I called on the phone. I'm like, hey guys, because I knew that I was a resident there. I said, I'm bringing in a level 1 trauma. And, we worked the guy in the trauma bay for a little bit, and ultimately he ended up passing away. And I know that kind of ruins the story, but at the end of the day, it gave me what I needed to realize that perspective that I was on top of the world. I was very quickly on the bottom of the world. And then at that moment, when I was intubating this poor guy who didn't survive in the middle of the road, I knew that I was his only chance at survival. And had I not been there, he would have died alone on the street. And I was able to at least talk to him and get him over to the ER. And I felt really good about myself at that point, even though he died. I know that sounds weird, but it just gave me such incredible perspective that I'm going to have failures in healthcare, but sometimes you can have those wins too, where you are able to help people. Now, in this time, it obviously didn't work out. He was too injured to come back from that. But I'll never forget that story because it's just such a range of emotions and things that have happened in just one day. So that's a story that changed the way I look at life. That was definitely an eye opener.
Thank you for sharing that story. I feel like that was a movie.
But call Netflix. Let's see if they'll,
The stakes are so high for what you do, and you care so much about people, and you've done this for so long. So how are you not burned out? How do you stay grounded and connected to the patient in front of you? And
yeah, I mean, bourbon mostly, but no, it's hard, and it's hard because we do care. And I know it doesn't seem like we do. And by the way, to an extent, we have to not care, on some level. I have to, I've had to tell people that their 6-month-old is dead, and then immediately return to my desk where there are 23 patients waiting, 5 in the waiting room, and they're all pissed off. They don't understand what I had just gone through with this poor mother or father. And you have to create some level of detachment. And unfortunately, it's a balance, just like anything in life, to be able to have that wall up enough that you can continue to function, but you still want to show to people that you care, because of course we care. No one went into healthcare for rich and fame, or at least I hope they didn't, because they're going to be very dissatisfied if that's the case. But you have to kind of build up that layer. Otherwise you do get burned out. And after 20 years of doing this, they make it harder, because now we have to do, we have to see more patients with less resources, less staffing, short staff, short nurses, and we got to do all this extra stuff, extra paperwork, and we have to document this, and why didn't you document that? So they do make it more difficult for you to care. And, it was just my last podcast. I said, I just want to take care of people. I just want to connect. And it's very hard nowadays to connect with your patients. When my average patients I see in a day it's insane. It's through the roof. I see 63 patients every 12 hours. And I do that with 1.5 PAs, but it's really hard. And those connections that really give me the fuel to keep going, they're very few and far between anymore, despite some of our best efforts. And I do try to connect with patients. I almost always try to make them laugh, always. And I try to talk to them about something other than healthcare when I have time. Just like, you were at that restaurant. What'd you think about that? Or, just something that just brings me down to a human level, so they understand that I'm a human too. And I do care. And I think that's helped me through my career.
That's really good advice. It's hard because there's so much misinformation out there right now. And then the way the system is set up, we're kind of set up to fail, because we oftentimes don't have, like you said, you don't have time to build trust even if that one question about a restaurant, or noticing that they have a sports team shirt on or something, it can actually make a really big difference.
And I think it's important to think about that mistrust, right? A lot of our patients are coming in with that. So that makes it even harder. It's not what we want. It is the best that we can do sometimes. And I think that's tough. The ER, that's like the wild, wild west of the hospital, right? I mean, everything. Another issue that drew me to your platform was the healthcare worker assault that you have been bringing up and talking about. And I think that ties into that mistrust. And how do you deal with that? Like, you never know what you're getting in the ER.
Yeah, and it's hard, and people don't understand this, that, you know, you're caring for these patients, so it's not like you're walking in there where a trained police officer or something might be obviously better prepared to deal with that situation. You're going in there from a place of, you know, humility. How can I help you? And I've had patients take a swing at me. I had to tackle a drunk patient once who was about to hurt one of our nurses, and I actually broke my thumb. These things happen all the time, and it's very difficult to maintain that balance. And it does, I don't know if it's just being reported more or if we're actually seeing it. It does seem like it's on the rise, and it's hard because it puts us in a really tough spot. And I mean, you're right. These patients, they don't trust us. And, you know, part of me doesn't blame them. It's a broken system. It's jaw dropping, some of the stuff that I see, and people do slip through the cracks, and you have to be your own advocate as a patient, as a family member, as a caregiver. A normal person that like has no like interaction on a daily basis with healthcare, if they shadowed me for a few hours, I think their entire world would be turned upside down as to like, where are these people coming from and how do they treat you this way? It's a tough world. Like you said, the wild, wild west.
It is tough.
I was thinking that, I know you joked around about the bourbon part, but do you remember at what point in your career where you didn't necessarily take home all of it on your shoulders and all of it in your head? I mean, we had very different jobs than you, right? But I just remember the first couple of years just being in an acute rehab center where I feel like I took the burden home on every patient because I was new to it. But then somehow there was a switch, and I don't know what it was, where I wasn't attached, where I could separate it, like you were saying. It was almost like a necessary separation. And I kind of remember it happened for me like after 2 years. And then every once in a while throughout my career, there was like a impactful case that like really got me down. But other than that, I was able to kind of go through my day every day without thinking really twice about it, to be honest. And I was just wondering if you can recall or reflect on something similar.
Yeah, I think for me, it's kind of like a callus. You know, you have to kind of get that wear and tear on your soul in order to harden it up enough that you can kind of just live with it. And it's just there, like that callus that's on your finger, and offers you a little bit of protection there. I don't recall a specific moment. It was definitely after residency. I mean, residency, because you haven't made it yet, right? Like, you're trying to make it. You're not an attending. The residency, I feel like I took everything home with me, ups, the downs. Then you become an attending and you're still kind of scared, but you're like, all right, I've kind of made it now. And then after a few years of being an attending, I agree with what you said. Like, you kind of learn to build that callus, and then you're able to sort of just deal with those things. But I'll tell you, the one thing that did change is having kids. And that was like the worst thing, because not to say that when you lose a child, I mean, that's always a tragic, horrible thing to deal with. But I'm going to tell you, when you lose a child and you have 3 of your own, it hits different. And I tell this to my guys that don't have kids yet and stuff like that. I'm like, it makes me a better doctor 100%. I know I'm more comfortable with kids. I know their rash is better. I know, when they have a cold versus teething, like you just, there's just things, as a father and as a parent. But man, when you start losing kids as a father, that's where I have to actually like physically walk out of the ER for 5 minutes and like compose myself, and then get back in that chair and sit down in front of that darn computer and just keep going forward. So I'll tell you, it's like that pendulum, right? Like in residency, I'm taking everything home. Then after residency, I'm like, okay, I can deal with these losses. I can deal with this tragedy. Then I become a father, and I'm like this total softy now, right? Like, and you shed tears with these families sometimes when they have kids that die and things like that. And it's probably made me more compassionate, but it's almost easier the way it was before without kids. So.
And it's so mind-blowing to me that you go into this profession and they are not even like, nobody's like, hey, here's a warning sign, here's some tools to deal with these things. You're just put in there and you've got to do it, right? And it's not about you, and it's about the patient. But there's such huge rates of burnout right now. And I mean, and it's not a problem that is specific to the US. I'm like looking through the research, it is worldwide. We are not giving healthcare workers the support that they need to work through these things.
Yeah, and people talk about mental health and things like that, and now it's like kind of, I don't want to say trendy because that cheapens the importance of mental health, but it does seem sort of trendy that these athletes are coming out and saying like, it's okay to talk about this, and that's great. It is great, but to your point, no one teaches us how to deal with these things. They teach us the medicine that is involved with emergency medicine, but they don't teach you how do you deal with these demons, a little bit of PTSD from the tragedy that you've seen or the horrific pictures or stories. And so it is a bit of a challenge, but I think it definitely leads to having just that stronger mindset. And I teach my son this all the time. My son's a tremendous athlete. We talk about sports all the time. It's a very big part of what we do. But I talk to him not just, he's got God-given physical gifts, but I talk to him all the time about the mental aspect of being an athlete, having that Mamba mentality, being mentally tough and being able to push through these things. The other night, Kyrie Irving just blew up his knee on national TV, was able to somehow limp to the free throw line, makes 2 free throws, and as he's doing so, I believe uttered the phrase, "Thank you, God." And he made these 2 free throws. And you're just like, that's incredible. Like that, the mental and physical toughness to do that. So, not to say I'm anything like, Kyrie Irving or anything like that, but just, I think having gone through these types of experiences, it kind of hardens you, gives you that mental toughness. But yeah, to your point, there's days where you do bring it home with you and it's hard. I'm grateful that I have about a 45-minute drive home that allows me to sort of decompress before I bring that into my household with my kids, with my wife. And but I have that support system at home that I can always come home to, which is really important to me.
Do you ever, when you get home, talk about it?
It's a great question because my wife is in healthcare as well. Now she stays with the kids, but she was in radiology. She always, once in a while, she'll bring it up and she'll be like, we can talk about this if you want to. And I don't often talk about, if there's something funny that happened, I'm a humor guy. So I'll talk about funny things and that kind of stuff because it makes me laugh, but I don't usually talk about the horrors. And then once in a while she'll like hear me say something. And I think she just kind of knows that something happened that was not great. And I think she probably would like for me to open up more about it, but there's a part of me that has to somehow try to find that balance of not talking about it and keeping it behind that calloused wall in order to continue to just sort of move forward like nothing ever happened that day.
But you mentor a lot, right? And I'm sure different people have to like process in different ways. So how do you talk about that to people that you're mentoring?
Yeah, I think everyone's got to kind of find their own path on how they do that.
You give them bourbon at the end of the shift.
Yeah, right. Yeah, I do. As a matter of fact, I literally, our volumes are through the roof right now because of flu. And so I've been buying like 12 packs of beer and stuff for our PAs and our, like, just here's the one guy wanted like Angry Orchard. I'm like, here you go. Here's 12 of them. You're doing a great job. Like, keep up the good work.
Best boss ever.
Motivation.
Yeah, exactly. It's like motivation, but kind of bribery. Cause I'm like, I really need you to come in tomorrow too, cause we're getting killed. Yeah, no, I think everyone has to kind of find their own path that works for them as far as, being able to process this and being able to deal with it. I'm not even sure I have the right path. Just a few weeks ago, I was on TikTok driving home, and I don't like watch the videos, understand that. I just listen. I see enough car accidents. I started listening to like piano music, like out of the blue. And I told my wife about this. I'm like, it just like relaxed me, like helped me unwind after my shift. And I'm like, I'm going to try this for a little bit. And so like, it seems to work. I think that ability to kind of deal with these things and process it and move forward is something that each individual has to find. But yeah, when I mentor these people, I do try to, my big thing is not just to teach them about the medicine part, because I think I don't want to say it's the easy part because that's hard too, but I try to teach them the other sort of intangibles. Like, how do you run a department? How are you efficient in the emergency department? And yeah, how do you deal with some of these challenging situations? Not necessarily should I give antibiotic A or B, but like, how do I deal with this? Should I call a consultant? And, just sort of like those sort of inner workings of being a healthcare professional.
We could talk to you for hours, literally, but just wanted to see if you could leave us off. This is a Humanity RX, so we like to have our guests leave a prescription for humanity, just something that you can drop to our listeners who just might take a little nugget and be able to run with it and think about it. Just something that can resonate.
I think for me, something that has stuck with me, and I don't know if you follow this guy or not, I don't know if I'm saying his right, Jocko Willink. He's got some great one-liners out there. And my favorite story is the one he tells about the word good. And I don't know if you ever heard that before. Like, you didn't get the promotion, good. It means you got more time to do better at your job. And then the next go around, maybe you can get that promotion. Or the ER is full of patients, good. That gives us an opportunity to take care of all these people and help them and really make a difference. And I sort of use that prescription with my children, which they are too young to understand that I'm not being a jerk, and I'm really trying to sort of mentally harden them. But there's such a mind-body connection, and you cannot let some of these poisonous negative thoughts occupy your brain, because you will become a very negative person. You will lose your center of who you are, and it just really impacts your ability to be happy, and you just have this foundation of negativity. And so it is hard, especially in the emergency room and in healthcare in general. But I do try to prescribe to that, good. And a lot of people that work with me, they'll hear me say that. Oh my gosh, this, another family of 5 just signed in, and they're all here with, they've got a cough for an hour. Good. Let's see if we can take care of them. Maybe they're, not too sick. Let's get them out of here. You hear me say the word good a lot because of that quote that I kind of heard from Jocko. And I think it's a cool quote. And I want my kids to do that, to have that mental toughness to just say, it's a good thing. Let's turn this into a good thing. And it's almost kind of similar to the story of the Chinese farmer, right? I forget the exact story, but like the horse, goes out and leaves the barn, and he's like, the neighbor's like, well, that's really unfortunate. And he's like, well, we'll see. And then the next day the horse brings back, 200 horses. And he's like, well, now it's a good thing instead of a bad thing. And then the son goes on the horse and breaks his, leg or something. And they're like, well, that's a bad thing. But then the next day the son would have been called in to serve duty in the military at a war. And so now it's a good thing. And it just shows you kind of through life. And I think that kind of is similar to what Jocko was saying when he was like, good, like, let me take this opportunity to make something positive out of this.
I love that. I think it's all about perspective. One of my favorite quotes is by Viktor Frankl, and he said one of the last of the human freedoms is your ability to choose your attitude in a given set of circumstances. So that along nicely. Thank you so much, Dr. Parente, for being here. We appreciate your time and all the work that you do.
Thank you for listening to Humanity RX. We hope today's conversation gave you something to think about, and maybe even feel a little more connected to the human experience. To find out more about our guest, please find more information in our show notes. Humanity RX is created, written, and produced by the 3 of us, Jenny, Tovah, and Jonathan. If you enjoyed this episode, we'd love it if you subscribed, left a review, or shared it with someone who needs a little dose of humanity. You can find us on Instagram at HumanityRxPod, or LinkedIn at HumanityRx. Until next time, be good to yourselves and each other.